Hello, and welcome to Auricular Acupuncture and Facial Pain. I am Brandy Underwood, Manager of Marketing and Communications at the FPA, and I will be joined shortly by our CEO, Melissa Bombick. I'm happy to welcome Dr. Gary Stanton, neurologist at Emerson Health and member of the FPA Medical Advisory Board. Dr. Stanton has subspecialty interests and board certifications in sleep medicine, pain medicine, clinical neurophysiology, and medical acupuncture. Thank you for joining us today, Dr. Stanton. Before we get started, I'll ask that attendees submit questions using the Q&A feature on your screen. We'll get to as many questions as we can after the talk. And now I will turn it over to you, Dr. Stanton.
Thank you, Brandy, and thank you everyone for attending this webinar on auricular acupuncture in facial pain. So what is auricular acupuncture? First of all, auricular pertains to the ear. So auricular acupuncture is actually ear acupuncture. We consider it a microsystem of acupuncture. In the world of acupuncture, there are several microsystems, including ear acupuncture, scalp acupuncture, hand acupuncture, and others. The definition of auricular acupuncture is a therapeutic method aimed at treating patients by the physical stimulation of reflex sites in the auricle of the ear. The auricle is the part of the ear that we can see and touch. So auricular acupuncture is a reflexo system. It's a reflexive system where we're trying to provide treatment by using reflexes within the nervous system. I'm going to go directly to the modern history of auricular acupuncture. So the modern history begins with a woman well known among auricular acupuncturists, whose name was Madame Barral-Cassalta, and she lived in France from the 1930s into the 1960s. She was well known in France. She was not a physician, but she was well known because she knew a secret of cauterization, which means the type of way to burn or scar a portion of the ear that I'll show you in a moment, specifically for treating the condition of sciatica. And people not only from Lyon, France, but from all over France, including celebrities, will travel to her for treatment of sciatica. The treatment required focal targeting of the skin and the underlying cartilage of the ear for treatment for success. She had learned the treatment from her father, who had worked for a French utility. He learned it from a Chinese mandarin in return for his service. So in the world of acupuncture, if you look at these old images here and a sculpture here, you can see depictions of the meridians, the acupuncture meridians, and then the points which are labeled here on this statue. You only see the points. But if you look carefully at the ear, you'll notice there's no points on the ear. So although the ear figures importantly in traditional acupuncture theory, there were no actually standard points on the ear itself. But the Baran point is approximately in this area coming up here, this area coming up here is the antihelix. This lower part where it crosses this rising part of the ascending helix is the area of the Baran point. That's the area that she treated for sciatica. And then things changed with this man. His name was Dr. Paul Nogier. Again, probably the most famous name in auricular acupuncture. He was a physician in Lyon, France, and also had knowledge of acupuncture. And so he rediscovered auricular acupuncture because the history of acupuncture in general, including in particular auricular acupuncture, goes way back into time. As my professor, Dr. David Animi of France said, it goes back into the night of time, probably passed down from generation to generation within families. And that's probably how it eventually worked its way to Madame Barral. Dr. Nogier in the 1950s was he was a very observant person for his patients. He observed patients in his medical practice in France who had all had the same area of the ear that had been cauterized with the cauterization performed by Madame Barral for sciatica. After he saw a series of patients, he became curious, went to see her, saw her method, tried it himself and his patients, and came to agree this was effective. Then he asked himself an important question. Well, if treating one point of the ear benefits one symptom, sciatica, is it possible that treating other points of the ear might benefit other types of problems? From this, he developed a whole system that he came to call auricular therapy, coming from Greek and Latin roots meaning treatment by the ear. Dr. Nogier had two major insights that allowed him to rediscover and further expand upon ear acupuncture. The first one was to see that the Baran point corresponded not just to treating a symptom, but also in his theory, according to a specific area of the spine, the lower lumbar area. Also, as he went about trying to see if other parts of the ear might correspond to treatment of other symptoms or even other areas of the body, he came to imagine in the ear a theory that consisted of a representation of an inverted human being called the homunculus of fetal proportions in the auricle of the ear. This was of similar quality and shape as another very well-known and scientifically accepted homunculus of a famous neurosurgeon named Penfield, who mapped out the representation over the brain of this inverted homunculus figure. Dr. Nogier, who drew this original image, imagined what he called a somatotopic organization. In other words, that certain parts of the body are represented, in this case on the ear, in a very specific type of way, with the same type of representation located over the cerebral hemispheres and actually in other parts of the body. For example, this portion of the brain colored in green is called the post-rolandic gyrus. This is a primary area for awareness of sensations. And that same type of homunculus representation, which is accepted as neuroscientific fact, has the head and mouth and the face in this lower area, the torso and arm in this area at the very top, and looping over the inside of the cerebral hemisphere, the leg area. So all physicians would accept the idea of this type of representation of homunculus, not only in this area of the brain, but also in several other areas of the brain, and also spinal cord to a lesser degree of elaboration there. All physicians accept it as scientific fact, but few physicians would accept Nogier's theory of an inverted homunculus in the ear as scientific fact. Nevertheless, people who practice ear acupuncture, as I do, through our experience and empiric use, come to believe that there's something to this theory. So much so that this type of microsystem of acupuncture is now expanded worldwide. The Chinese got wind of it through a publication of Nogier's discoveries in a German journal in Japan. The Chinese acupuncturists did their own independent research and agreed with Nogier and agreed with his theory of somatotopic organization in the ear, such that now in this year we have the 11th International Symposium of Auricular Therapy in Copenhagen, Denmark. So this has become a worldwide form of acupuncture that has been validated and accepted by the World Health Organization. Just a quick review of the ear. We see the ear is a complicated little structure, a little piece of flesh, relatively speaking, with certain peaks and valleys. We all know that this portion of the ear called the helix, and this portion, the lobular region, which we call in English the earlobe, this area in the center called the concha, and some of these excavations or fossa, one being triangular here and one being so-called scaphoid here. And each one has their own names in medical texts. And in the inside of the ear, there are also peaks and convexities, and a large portion of that part of the ear is attached to the skull. The ear, for a little piece of flesh, has a very complex innervation, and it has to do with neuroembryology, development of the human from conception through the embryologic period and then fetal development. There are three major nerves that innervate the ear. For people who are interested in facial pain, it's interesting to know that one of those nerves is actually a branch of the trigeminal nerve, the mandibular branch in particular, which sends a branch named the auricular temporal branch up in this portion along this area of the ear called the tragus, part of the antitragus, this part of the ear called the ascending helix, that triangular fossa area I mentioned. Then opposite that, more in the back portion of the ear, there's innervation not by a cranial nerve, but rather by spinal nerves. C1, 2, 3, and 4 spinal roots provide an innervation, especially to the earlobe in this back portion of the ear. And then this central portion of the ear called the conchal region is interesting too. It's innervated by a branch of the vagus nerve, the 10th cranial nerve, And this is the only area on the body where sensory testing of the vagus nerve is accessible to clinical examination. So if you scratch this area of the ear, you're directly stimulating your vagus nerve. And on the back portion of the ear, there's other innervation depicted. There are other nerves that innervate the ear, but for sensory and motor purposes, and having nothing to do with the hearing function, which of course is coming from the internal ear, along with the balance function. Nogier corresponded these areas of, or these instances of embryological development to certain master points in the ear, which he called them omega points. This being omega itself, which is a master point for tissues of ectodermal origin, meaning tissues related especially to the skin and nervous system development. Omega 2 at the very top, representing tissues, master point of tissues of mesodermal origin, and then omega 1 and master point of endodermal origin. The vagus nerve is a major point for major nerve for innervating the organs of the thoracic and abdominal cavities, and so these are the master points for those areas. And there's a point 0, which has its own function. There's a central point of reference. Well, I'm a neurologist, and so as a neurologist, when I look at the ear with my auriculotherapy hat on, this is what I see. I see this notion of the theory of the inverted homunculus, such that this lobular region corresponding to the head and facial area is attached to this area here, which is in Nogier's theory corresponding to brainstem, and this area here, spinal cord. So this whole area, as well as this area here, will correspond to representations of the central nervous system. Everything else, the upper and lower extremity representations, the upper and lower extremity representations and the thoracic and abdominal vista representations would correspond to areas of peripheral nervous system innervation. Well, what interested me in auriculotherapy was this statement by my teacher in France, Dr. David Alimi, of the Faculty of Medicine of the University of Paris 13. And he said to me that auriculotherapy is nothing more than applied neurophysiology. Unlike most of traditional acupuncture, including scalp acupuncture and hand acupuncture, Nogier was a physician first, and so he conceived auriculotherapy really in biomedical terms. And so as far as he was concerned, if you understand the principles of neurophysiology, you can apply them to the field of auriculotherapy. This might be a little complicated, but just to give you an idea of the biomedical and neurophysiological understanding, explanation for the function of auriculotherapy as a reflex therapy, the main notions in neurology would be the notion of something called neuronal plasticity and also redundancy. So the term plasticity refers to changes that occur over time of properties in which information is processed in a nervous system network. If you would take a wire and plug it into a wall socket, that type of connection is pretty fixed. There'll be a certain amount of voltage and current that is passing through. But connections among nerves are called synapses, and they're biological tissue, so they're not the same as something like a plug in a socket. These are living tissues, and they're dynamic, and they can be upregulated and downregulated. And so that ability for it to be modified is referred to as plasticity. Redundancy means that there is the physical presence of surplus backup networks. In other words, the brain has many physical structures representing plans A, B, and C. Should one system fail, there'd be backup systems. The representation of the body in the auricle of the ear, which is called somatotopic, is based upon the ear's nerve connections with the brainstem. The ear, as you saw a moment ago, has major connections with the central nervous system, which in turn connect with projections of the whole body's schema, not just from the ear, but all of the sensory information coming from the whole body, then are projected to the rest of the brain, even coming to consciousness. So alterations in the body's representation of the brain therefore cause changes in the electrical potentials in the ear. Acupuncture points in general can be detected using certain types of instruments, because in general, body acupoints, and in particular ear acupoints, are characterized by abnormally decreased resistance in electrical resistance, allowing them to be detected. Treatment, which is done by stimulating those ear points, then brings about a nerve reflex that's aimed at optimizing brain homeostasis. Homeostasis is a word which refers to an optimal balancing of brain functions. The Chinese system, the Chinese adaptation of ear acupuncture is based in traditional medicine, but still there are parallels. For example, homeostasis in biomedical terms, I think, is akin to the Chinese notion of harmony and disharmony, yin and yang, if you will. So when we treat auricular points, we are targeting the brain's representation of this homunculus, but not only in the ear, but also in the brain itself, as it's believed to be a representation of that homunculus in the ear. We are targeting a representation, essentially, of the homeostasis of bodily tissues via their associated central nervous system, organization, and control. So therefore, if we treat an auricular facial point, for example, for someone with facial pain, we are not treating the face directly, but we're treating its somatotopic representation homeostatically in the ear, pertaining to the way the brain regulates and understands the physiology of the, in this case, the face itself. This is why Dr. Alimi refers to auricular therapy as applied neurophysiology. Very different from traditional medicine. So modern auricular therapy is a French innovation. Most acupuncture and its derivations are of Asian origin, particularly Asian origin, but with roots in traditional auricular therapy and conceptualized in terms of biomedicine. Chinese acupuncturists study this and then developed a modern Chinese system of auricular acupuncture, which was then adapted to traditional Chinese medicine. In the far past, Chinese acupuncturists sometimes treated isolated ear points for symptomatic purposes, but it wasn't until Nogier came along, where an entire system was created, that the Chinese agreed with it and adapted it. Both approaches recognize a somatotopic organization of reactive ear points or zones, and both involve stimulation of ear points by needling or other methods. However, these two approaches differ in their rationale, one being biomedical and the other traditional medical. I'm not going to go into this, but I just want to convey to you that that acupuncture in general and in ear acupuncture in particular are supported even in biomedical literature. We believe that these are evidence-based medicines. This is just one example of an article that was an overview of many systematic reviews, which basically conclude that treatments, acupuncture may have positive effects in treatment of insomnia, chronic, and also acute pain, but that further well-designed studies are required. We always need more studies, more investigation. Well, even though some physicians might not accept, and understandably so, might not accept the notion of the Nogier inverted homunculus representation in the ear, still, in medical school, every single student learns something about the ear's utility and diagnosis. For example, there's a very famous sign called the Frank sign, which consists of this deep crevice that appears in the earlobe or lobular region of the ear. And we learn in medical school that if a person has a deep groove on both sides, then there might be an increased risk of underlying coronary artery disease. This is the best known example, especially in Western medicine. There are many other examples of the utility of the ear or the inspection of the ear in diagnosis. And the Chinese auricular acupuncturists in particular added a lot to that. Now we're going to go and start to talk about facial pain a bit. So just to give an overview of facial pain, the topics that are related to facial pain, this is according to the International Headache Society's international classification of headache disorders, includes cranial neuralgias, central nervous system and primary facial pains and other headaches, including trigeminal neuralgia, post-herpetic neuralgia, central nervous system, post-stroke pain, persistent idiopathic facial pain, and others. But then also facial pain can be linked to primary headache syndromes, including migraine or tension type, cluster headaches. There are secondary headache syndromes, such those that, for example, are attributed to head or neck trauma and may be associated with facial pain. Then there are a variety of other headaches or facial pain syndromes attributed to disorders of the skull, neck, eyes, ears, nose, sinuses, teeth, mouth, or other facial or cranial structures. I can't talk about all of these right now, but I'll touch upon some of them. Here's another example of a review of acupuncture in its use for trigeminal neuralgia. Coming down here, there is evidence that acupuncture may be effective. However, it's stressed that the evidence is relatively weak and that more studies are needed. Focusing more on auricular acupuncture, it's interesting. The ear is a treatment target where biomedicine encounters traditional medicine. The French approach to ear acupuncture, which is called auricular therapy, is based upon biomedical principles. Its description was by Dr. Nogier. The Chinese approach to ear acupuncture represents an adaptation of the French approach with emphasis on treatment based on traditional medicine, concepts of yin and yang and others, which I'll come back to in a second. Depending on the source, this may be combined with biomedical concepts, because obviously biomedicine is also well taught in China, as it is in the rest of the world. Traditional medicine diagnosis involves health considered to be present when a person's energetic functions are in harmony, balance. Symptoms of diseases appear when there is disharmony. Harmony and disharmony, which, as I alluded to before, are akin to homeostasis in biomedical terms, are described with reference to traditional concepts of yin and yang, notions of 5 elements, qi and blood, functions of organs and viscera. I just want to point out to you that these words qi, blood, organs, and viscera have all initial capital letters to make sure that the reader understands that these notions of organs and viscera, for example, or blood, in the traditional sense, are very different from the modern sense. And in traditional medicine, organs, viscera, qi, and blood are more conceived of in energetic terms, and it's not the same neuroanatomical and neurophysiological terms that we use in biomedicine. So treatment in traditional medicine aims to restore harmony. This is a coherent system that is at least 2,500 years old and probably even much older. It has literally stood the test of time. Acupuncture is recognized by the World Health Organization and it's taught in certain medical schools and acupuncture schools in the US and abroad. How about the face in traditional medicine? In traditional medicine, the face is considered a microsystem. Here in this ancient text called The Simple Questions, it was written, in heat disease of the liver, notice with a capital L, the left cheek becomes red. In heat disease of the heart, the forehead becomes red. In heat disease of the spleen, the nose becomes red. In heat disease of the lung, the right cheek becomes red. In heat disease of the kidneys, the chin becomes red. These are traditional concepts and a traditional way of inspecting the face for diagnostic purposes. How about Chinese ear acupuncture for facial pain? I'm just giving you an example here of some typical types of Chinese traditional diagnostic categories. Remember, these are all considered in terms of their energetic meanings. So in diagnosing facial pain, you might have a traditional acupuncturist use diagnoses such as wind heat, wind cold, damp heat, liver fire, and qi deficiency and blood stasis. Highly individualized. In Chinese medicine, the whole person is understood, the whole person is targeted, and there's no one treatment for all people with the same symptom. In fact, it's the exact opposite. The treatment is highly tailored to the individual. Although trigeminal neuralgia was not a traditional diagnosis, when you consider the symptoms, Giovanni Macciosa, a very famous acupuncturist and author of very famous books in acupuncture, said that the symptoms may be likened to, in traditional terms, to liver fire combined with liver yin and kidney yin deficiency. And using those notions might plan a traditional treatment. I'm not going to go into this, but this is my adaptation of a Chinese auricular cartography published in a wonderful book, Chinese Auricular Acupuncture. The author is Dr. Skaya Abate. And so this is just to show you some idea of the cartography. You notice the clustering of points here in the contral area, the superior and inferior. Remember, the organs, the heart and lungs are located here, and the abdominal organs, including liver, spleen, and others and pelvic organs are located there. So the organs and viscera are central to traditional diagnosis and treatment. On the back of the ear, there are some points, but they're relatively sparse as compared to the outer aspect of the ear. This is from a well-regarded textbook by O'Connor and Bensky. The textbook is basically a translation of the Shanghai School of Acupuncture in China. And so this is one Chinese ear acupuncture scheme for treating trigeminal neuralgia. There are points that are, again, somatotopically based, of treating the maxillary area, mandibular area, forehead area, and then there's another point that they call the sympathetic. One example of what a Chinese ear acupuncturist might do to treat somebody with ear acupuncture. Because the organs and viscera are so important, there are points that one might consider treating from a traditional point of view, even for facial pain, such as trigeminal neuralgia. But I want you to pay attention to this area here. Remember that the Chinese school also accepts the Nogier's theory of a somatotopic organization, putting the facial area down in the earlobe or lobula area. And as you know, acupuncture typically involves the placement of needles, and so these points might be needled. There are many other ways of stimulating the points. Needling is a type of mechanical stimulation, but it's possible to stimulate the points other ways, such as with laser light, putting magnets on. The Chinese acupuncturists like to put certain seeds or on the ear. So there are ways of applying acupuncture that are not necessarily needling. So people who are phobic of needles should be reassured that there are ways to give acupuncture without the needles. Now we'll go to auriculotherapy for facial pain. Remember that auriculotherapy is a name that should only be applied to the Nogier style of auricular acupuncture. So these cartographies, again, for comparison to the others, I won't go into them. These are from my school, the University of Paris Faculty of Medicine, courtesy of Dr. David Alimi, my professor. And these are some cartographies that represent the somatotopic organization as described by Paul Nogier. You notice that on the back of the ear, it's a little bit richer in points as compared to the Chinese. I'm not going to say to you that one approach is better than the other. I believe that each approach, the Nogier approach and the Chinese traditional approach, each one has its strengths, each one has its weaknesses, and I believe that there are many paths to the truth. How about the auriculotherapy of pain? Just to remind you about the IASP definition of pain, it's an unpleasant sensation and emotional experience associated with actual or potential tissue damage or described in terms of such damage. Pain is a neurological signal that is essential to homeostasis. We need pain to tell us that something is wrong. The acuity of the pain is a function of the nature and intensity of the lesion that causes it, but chronicity, is defined as more than 6 months, often involves the involvement of brain systems beyond the detection of pain itself. For example, the limbic system is an important system within the brain that has great bearing upon one's emotional life, the functions of the autonomic nervous system, connections with nerves that, I'm sorry for that, pertain to endocrine regulation and also cognitive aspects. So if we step on attack, for example, there's more than just the painful presentation, the painful symptom that we're aware of. It might create fear, it might cause a withdrawal response, it might unconsciously or consciously remind us of prior experiences. So pain evokes and is linked, especially chronic pain, to many different nerve processes. When it's chronic, pain loses the useful biological adaptive role and it can take on a life of itself. In general, there are three major types of pain stimuli. One is called nociceptive within the skin and rest of the body. There are special sensors, that some of which are active, some of which are called silent, that these become activated, and when these sensors detect potentially harmful processes or outrightly harmful processes, they will be programmed into the nervous system and attain consciousness as pain. If the nerves themselves, the nerves that are connected to these nociceptors, if they become damaged, as in, for example, in the case of trigeminal neuralgia, an impingement of a vascular structure on the root of the trigeminal nerve, then the pain may arise from nerve damage itself or nerve irritation. Then there are some that are unknown. We use this word idiopathic just to mean we don't know. And some pains can actually be psychogenic, we think. And all painful input triggers actually two modulatory systems. As painful feelings are conveyed into the nervous system, coming from most of the body, remember, including even areas of the ear, processed through the spinal cord, and they're as they arise from the areas of the spinal cord up to higher centers in the brainstem, areas below the surface of the brain, and areas of the brain itself, they are shaped, and they actually are shaped in a way that's called a facilitatory system that gives pain or other sensations their various qualities and quantitative aspects. But at the same time, opposing that ascending pain signal, there are descending inhibitory modulating systems that can dampen down the pain. The aim of auriculotherapy is to affect a neuromodulation. We want to modulate that, especially the inhibitory system, and affect these other gate control and other so-called brain filter systems in order to dampen down those painful signals. And so there's a general strategy in biomedical auriculotherapy of selecting points. We don't just randomly put points in the ear. We'll target the organ point. In this case, for example, the trigeminal dermatomes, depending on which one is involved, V1, V2, V3. We might target roots pertaining to the spinal cord, and then these brain filters that I just mentioned, representations that we believe in the ear that correspond to these other central nervous system structures that modulate pain. Although ear acupuncturists auricular therapists may also use standard needles. Nogier developed his own special needle. He was inspired by this from an American type of ear treatment called stapling, which if you Google ear stapling, you can see what that involves, putting a type of staple in the ear. Nogier thought that was a bit too aggressive, so he created this needle, which is called ASP needle. That stands for French words meaning a semi-permanent needle. This is a 2 millimeter needle. As you can see, it has this little mini barb at the end and a nubbin at the other end, which prevents it from sinking under the skin of the ear, but this little mini barb prevents it from falling out. So most commonly in France, when acupuncture is given, ear acupuncture that is, we give it using these little ASP needles, such that, and in distinction to most other forms of body acupuncture, where the needle is put in and then withdrawn prior to the patient leaving, this needle is put in and the patient leaves with those little needles still in the ear. So instead of being retained in the point for half an hour or an hour, those needles might stay in for at least a day, several days, a week, maybe even 2 or 3 weeks. In my office, the record is 6 weeks. And as long as the needle doesn't cause inflammation or infection, which is a risk of an indwelling foreign body in the skin, even though the risk is very low, then the presence of the stimulus is now vastly greater in auricular therapy than it is in just about any other form of acupuncture. And Nogier believed that this added to its benefit. This is Dr. Alimi applying the ASP needles. You notice he's wearing gloves. We put alcohol in the ear. The needles are sterile, single use. And there's one little needle here at the very apex of the ear. And there's another one that he's applying down here in this area. And this little injector conveniently puts it in. And so it's a pretty quick treatment. My professor, Dr. Alimi, also came up with an idea to use liquid nitrogen, or N2O, as an alternative form, non-needling form of stimulation. He has N2O, it's in the canister. He concocted this type of applicator. It's applied to the ear in this way. And when a little lever here is depressed, the N2O gas appears, and you can see this area of the ears for an instant, it turns white. It's actually frozen. And then within seconds, that dissipates, and you're left with a little area of inflammation. Well, if you put a needle in the ear, you're also going to get a little area of inflammation, except that in this case, there's no needle. So many of my colleagues in France are using this, what he called cryotherapy, as an alternative to ASP needles. My personal bias is in favor of the needles, although I do use both. Especially I use the cryotherapy for people who don't want the needles. This slide from one of my other teachers, Dr. Bernard Leclerc, shows this area of the ear, according to Nogier's somatotopic representation, that has high correlation with facial pain, the trigeminal dermatomes and other related structures. In fact, some people who have facial pain might even try gently massaging this area. You can just gently massage it. Or in children who have some facial pain, you can use a little Q-tip with a little oil and gently massage this area. Remember, the needle is not necessary. What we want to do is stimulate the point, and massage is one other way of stimulating the point. So here's the representation of the trigeminal dermatomes according to Nogier's scheme, V1, V2, and V3, located in this area. When detecting points, we typically will check for, if we have an instrument, either low resistance patterns to let us know we have the point properly situated, or we'll use a probe or pressure probes to look for sensitivity, because these areas tend to stand out. People who have, let's say, chronic facial pain syndrome will tend to have more tenderness in these areas than, let's say, different areas of the ear. And there's another point here that corresponds to brainstem. And at the same time that we might trigger those, as I mentioned before, so-called organ points, or the target points, that here are other structures that Nogier associated with brain filters, including the reticular formation point, thalamic point, and master cerebral point. This is a famous point in the history of ear acupuncture, because this point is also known as the eye point. You've all seen pictures, I'm sure, of buccaneers, the pirates who had a big earring in the ear. Well, they didn't put an earring in their ear just to look cool. They put it in because by putting a big heavy earring in the ear, it would put pressure on this point. They believed that it would help improve their acuity in general. And so if you're on a pirate ship, you want to look at the horizon and scan for the sails of potential threatening vessels or potential target vessels to go after them. So This goes way back in time where stimulation of this point was thought to benefit vision. And still, even to this day, people with eye diseases, we will often consider using this point. Coming back to trigeminal neuralgia, a recent classification divides it into two general categories. Trigeminal neurogenic pain is classified now into classical trigeminal neuralgia, which includes both idiopathic, in other words, we're not sure of the cause, as well as known vascular impingement on the trigeminal roots. That replaces the prior use of the word primary. Persistent trigeminal neuropathy applies to trigeminal neuralgia due to a neuroma, tumor, multiple sclerosis, or other causes. That replaces the use of the prior term symptomatic trigeminal neuralgia. And then persistent idiopathic facial pain, we just don't know the known mechanisms and think they're possibly multifactorial. That replaces the use of the term atypical facial pain. This is from Bonica, my favorite textbook of pain. And these are just descriptions of classical trigeminal neuralgia, purely paroxysmal, without a persistent background facial pain. The diagnosis requires recurrent attacks of unilateral lancinating pains without persistent pain between attacks. Triggering of pain by stimulation of a trigger point, typically on a part of the face other than the area of the pain itself. And it's usually, and also some people use this as part of the definition, it's usually responsive, at least initially, to certain pharmacies, especially carbamazepine or oxcarbazepine. And the classical trigeminal neuralgia with concomitant persistent facial pain will have a persistent background facial pain in addition to the acute lancinating neuralgic pains. I like to put in this slide, this I adapted directly from Dr. Jeffrey Brown from his presentation last year to emphasize that before we give any type of treatment, no matter what it is, be it medical, be it acupuncture, anything, we always want an accurate diagnosis. And I thought Dr. Brown made a very important point that in the diagnosis, especially of trigeminal neuralgia, that an MRI is essential and it must be done in a certain way with these particular programs. Fiesta, CIS, or VIBE are alternatives, and different characterizations of the thickness of MRI slices, brain MRA and MRV are recommended. And Dr. Brown made the point, and I mentioned this now in all my lectures on this, that just because a standard brain MRI is reported to be normal does not necessarily exclude a trigeminal vascular impingement syndrome. And the MRI is only as good as the doctor that interprets it, so it's best interpreted by a neuroradiologist familiar with this type of MR imaging. We want an accurate diagnosis before we think of any type of treatment. Auricular acupuncture for cranial neuralgias include the diagnoses of classical trigeminal neuralgia, glossopharyngeal neuralgia, nervous intermedius neuralgia pertaining to the 7th cranial nerve, vagal neuralgia, the 10th cranial nerve, and other cranial neuralgias. I don't have time to go into all of this. So just touching on auricular therapy of trigeminal neuralgia, this is a type of a protocol that I might use. Depending on what dermatome is involved, I might treat V2 or V3, less often V1. The brainstem point, this point again is one of the points pertaining to one of the brain filters, reticular formation. This point for pertaining to the thalamic pain filter, and remember the eye point. Sometimes I'll use all three of those. This would be a very typical type of treatment protocol. Dr. Alimi, my teacher, always said that if it's successful and the patient is symptom-free, don't repeat it, and only don't repeat it for patients who are symptom-free. He advised only using this protocol for people who have active symptoms. This is one of my patients. This is a 40-year-old female nurse who had a 15-year history of right maxillary 8 to 9 over 10 paroxysmal pains triggered by touching the right cheek or by sucking on a straw or upon cold wind exposure. She had some response to anticonvulsant drugs, but she couldn't tolerate them. The doses that were required to suppress her pain caused her to have slurred speech. She couldn't work, and so she wanted something different. She wanted to seek out other alternatives. In her case, very fortunately for her, she told me that auricular therapy gave her a 90% pain relief, which was phenomenal. Of course, there's no panacea here. There's no one treatment that will help all people. However, in her case, she had a very good outcome. This is the regimen that I used for her. She had pain in the cheek area, so I used the V2 point. I used the omega point that I mentioned before. This is the master point for tissues of ectodermal origin, including the nervous system. I used this point that I showed you before, the reticular formation point. There's a point that Nogier attributed to potential weather exposure, and she told me that whenever cold hit her face, that was one of the triggers, so I treated this point. Sometimes patients who have facial pain will have input from cervical structures. I'll get more to that in a little bit. And so in her case, the cervical ganglion point, I thought that there was an autonomic or sympathetic component to that pain. This is another very famous point in ear acupuncture called the Shenmen point by the Chinese and the Cosmonaut point by the French. Very, very helpful for calming one down, as an anxiolytic point, calming one down, promoting a more relaxed state. Just to quickly give you examples of other applications, glossopharyngeal neuralgia is rare as compared to trigeminal neuralgia, paroxysmal episodes of pain along ear and pharyngeal branches of cranial nerves 9 and also 10 sometimes. Again, lancinating attacks in this case, instead of on the face, on one side of the throat, occasionally radiating to the ear, typically precipitated by triggers such as swallowing, chewing, coughing, or yawning. If the vagal nerve is involved, there can even be fainting spells or seizures due to fainting in up to 10% of cases. Just in contrast to the points I showed you, so these are the somatotopic representations of cranial nerve 9, the brainstem point. If there's throat pain, I might treat this point called the hypopharynx. And also, even on the inner side of the ear, there are some points. Here's a point that corresponds to motor aspects or muscle aspects of cranial nerve 9 function and also cranial nerve 10 function. And again, that thalamic point related to pain filter. It's important also to know that chronic headaches can cause facial pain, including the primary headaches, migraine, tension headaches, cluster, exertional headaches, hypnic headaches, headaches that occur with sleeping. Interesting to note that except for the brain itself, virtually all structures of the head might give rise to pain. These include soft tissues overlying the skull and the skull itself, cranial nerves 5, 9, and 10, superior cervical nerves, intracranial venous structures, intracranial veins, and also arteries, notably at the base of the brain and of the dura, which is a tissue that overlies the brain, and the dura mater itself, notably at the base of the brain. All of these structures, if irritated, can give rise to pain. So migraine sometimes is associated with facial pain, so it has to be considered in the differential diagnosis of facial pain. These are the definition of migraines, at least 5 attacks lasting 4 to 72 hours, with 2 out of 4 characteristics, including unilateral pains, pulsatile like a heartbeat, moderate to severe, and it either was affected by physical activity, and also 1 out of 2 of these symptoms, either nausea with or without vomiting, and sensitivity of the eyes or of sound, which might worsen the pain. There may be a prodrome coming on even the day before. There might be an aura coming on up to an hour before, such as visualizing geometric shapes or lights, usually resolution with sleep, and there might be hangover feelings afterwards. The underlying nerve physiology is complex. Here's an example of points I might treat for migraine. Again, if the migraine spills over into facial pain, either the forehead, cheek, or jaw, then I might engage these points or target these points. Many times, especially with women, migraines can be menstrual related. If so, I might choose this point, which Nogier named the FSH-LH point, follicle stimulating hormone, and other points. I won't go into all of these, but just to show that the treatments are individualized according to the underlying diagnosis. Secondary headaches might include headaches from medication overuse, sinus headaches, head injury headaches, something called SUNCT, which is short-lasting unilateral neuralgiform headache attacks associated with conjunctival ejection, that means redness of the eye, and tearing, and also short-lasting unilateral neuralgiform headache attacks with cranial autonomic features, also called SUNA. There might be paroxysmal hemicranias and contact point headaches. Medication overuse is an important one to point out because a lot of people start taking a lot of over-the-counter medications such as Tylenol or even Advil, naproxen. These medications really aren't ideally designed for daily use, and yet some people will take a lot of these every day for long periods of time. They may create headache syndromes, and sometimes headaches that might spill over into the face with facial pain won't go away until one is tapered off of those medications. Well, there's a famous protocol called the NADA protocol from the National Acupuncture Detoxification Association, or NADA. I believe this was originated in New York, and here's their protocol. It's an ear protocol, and this is widely used for detoxification, including for medication overuse headaches, but also for opiates and other types of addicting substances. Sinus headaches, there was a wonderful talk last year, I'm sorry, I can't remember of the speaker, but who pointed out that sometimes people are repeatedly treated for suspected sinusitis with antibiotics. However, the underlying sinus symptomatology might not be caused by an infection. It might be caused by migraine. And you notice here that migraine might be considered in the differential diagnosis of sinus headaches, which can cause facial pain. And so, again, treatment, including auricular treatment, might include the possibility of an underlying migrainous cause. And a person with sinus-related pathology had forehead pain. Again, I might treat this V1 area, or cheek pain, I might treat the V2. The representation of sinuses are located in this area on the ear, and other points I won't go into, but just to show you again how the points might vary according to the diagnosis. Remember that facial pain may also be of dental or TMJ, temporomandibular joint origin, and TMJ disorders are the most common musculoskeletal cause of orofacial pain. There are two general patterns which may or may not coexist, including pain of myofascial or muscular origin within muscles. There can be so-called trigger points within the muscles. Again, not all doctors believe in that, but I do, and many doctors actually do. And interarticular disorders, including internal derangements of the TMJ, the jaw itself. The jaw area is located here. Again, even with the jaw pain, one even might try massaging this area of the ear, right at the angle where the descending helix of the ear meets this lobular region. And these other points can also be, notice again, the Shenmen point is considered in this particular protocol. I want to add a slide because this is important. So I don't know if many of you are familiar, but there was a famous duo of researchers, Travell and Simons, wrote a very famous book called Myofascial Pain and Dysfunction, the Trigger Point Manual. And they pointed out in their manual that facial pain can be caused by myofascial trigger points, not just in the face, such as in these areas, but even other muscles, such as the occipitalis muscle and platysma, which is in the neck, and some other muscles, the digastric. Some of these may manifest as facial pain. So it's important to keep this in mind. You know, we all want to have hope that we can, if one treatment doesn't work, we want to look for something else. Well, this is something else that I think is often overlooked. There's a famous neurologist named Dr. Robert Gerwin, and he's an expert in myofascial causes of pain in general, including facial pain. He wrote a wonderful review of trigeminal neuralgia, but in it he put forth a theory that he felt that especially the condition called persistent idiopathic facial pain sometimes may be caused by myofascial dysfunction. And if a physician would only think about that and search for myofascial trigger points, maybe some patients could be helped through that method. The biggest development in ear acupuncture in recent years has been this, something called battlefield acupuncture, that was conceptualized by Dr. Richard Niemsow. He was, I believe, an Air Force officer and physician. And he came up with this protocol, which now is adopted by the Pentagon. And so in all military hospitals, caregivers are being taught this method. It's an ear acupuncture protocol. And actually last week, Dr. Niemsow was presenting this to NATO. Most likely NATO was going to adopt it also. Clinical trials have shown very good efficacy for people who have acute pain. There's a protocol that he's published, and most recently, he's evolved this into a more advanced form. But if you just Google battlefield acupuncture, this is a huge development because even the Pentagon has invested, I think, $1 million, if not more, dollars in research and development and the application of this in the field. And many acupuncturists, all types, especially auricular therapists, are aware and often use battlefield acupuncture. Here are some references that you can peruse over. This is me with Dr. Halimi at the Gustave Roussy Institute, a big cancer hospital outside of Paris, 2010. Dr. Halimi was a wonderful teacher. I was lucky to have him. I'm a board member and a member of the membership committee of the American Academy of Medical Acupuncture. This is a wonderful resource for patients and families, and also for physicians for learning more about acupuncture. And for physicians, we want more and more doctors to become aware of medical acupuncture in general. We're hoping to have more physicians join us and offer acupuncture as an alternative treatment to their patients. Thank you very much for attending this, and this concludes my presentation.
Dr. Stanton, thank you so much. That was really, really informative. And we have tons of questions. I would say the most common one is, how do you find an acupuncture practitioner who's well-trained in treating facial pain, and maybe even a neurologist who is, trained in auricular acupuncture?
I think your best chances of finding somebody trained in treating the ear actually will probably be by finding somebody who is trained in a non-physician acupuncture school, because the Chinese adapted auricular acupuncture into their protocols, all graduates of U.S., Canadian, and probably many other European, South American, Asian countries, they're all learning ear acupuncture. Of course, they might adapt it in a more traditional way, but as I said before, it doesn't mean that it diminishes the value of this. So the most rapid way probably to find someone who can provide treatment by the ear is to find a certified licensed acupuncturist. There are physicians who are trained in this. In the United States, there are far fewer physicians who do acupuncture than non-physicians. And so you might have to dig a little bit, but a good resource for looking would be at the AAMA website that I just showed you. And they do have a list of resources, physicians who are trained in medical acupuncture they may wish to contact if they like a physician. And there the specialties are listed, even a neurologist.
Excellent. Okay. Would a patient get immediate relief after the first session of acupuncture?
It's a wonderful question. Nogier himself used to say that if the patient still has pain when he or she gets off the table, you haven't done enough. You should put the patient back on the table and continue. I have to say, I don't think, I'm not a Nogier, and I don't have that same degree of expertise than he had. And so, again, there's no one panacea. And so what I tell people is that we have to give it a chance. If you started a drug for acupuncture, if you had pain and went to physical therapy, it might be a little unrealistic to expect a cure right off the bat. But the protocol that I tend to follow, and my teacher, Dr. Alimi, would recommend, and that I follow, he recommends that patients give the ear acupuncture a try at least 3 times. And using this method that I studied in France, we usually recommend a series of 3, 1 treatment per month for 3 months. That's the trial. And in general, if a person doesn't respond in the course of those 3 treatments, I think about changing to other types of approaches. Now, having said that, I can say that I have had patients who had wonderful responses right away. And I have had patients who've gotten off the table for certain pain problems. What comes to my mind right now as I'm saying this is I had a woman who had terrible peripheral neuropathy with foot pains, and every single time she got off the table, she would tell her husband that she was immediately better, which was, as you can imagine, very pleasing to me. It's true that some people have rapid responses. The battlefield acupuncture, the whole protocol is aimed at trying to make sure that when the patient leaves, the pain is brought down. Nim Sao himself said to a 1/10 pain level. So if one can achieve that, it's wonderful. But not everybody can get that type of relief. And so I never make promises, but I think that these are therapies worth a try. And I didn't say this before, but the safety is one of the major reasons I learned this, because acupuncture is very conservative and it's generally safe if it's carried out by people who are appropriately trained. And so you have a relatively safe procedure that sometimes can be surprisingly effective.
Mm-hmm. And is acupuncture for trigeminal neuralgia, at least typical trigeminal neuralgia, is it performed on the same side of the face as where the pain is?
It depends on who you speak with. This is another difference. Nogier emphasized that the ear treated should be the same on the same side as the side of the face of the pain. The reason for this is that we all, I think popular knowledge is, we know that with the brain, the left side of the brain subserves the right side of the body, and vice versa. And so the ear on the right side of the body would have access to the left side of the brain, which is mediating the pains that are being perceived in the right side of the face. However, if you speak to a Chinese acupuncturist, you might find exactly the opposite. The very famous Chinese acupuncturist, physician, Dr. Stephen Ong of Canada. Whenever he would come and give us lectures at our New England Society of Medical Acupuncture, he would always treat the opposite ear, because in classical Chinese theory, there is a dictum. This applies to the principles of traditional medicine, which is, if pain is on the right side of the body, you treat the left, and vice versa. If the pain is in the head, you treat the foot, and so on. It's a completely different approach. I think the bottom line is that that one should be prepared to, if necessary, treat one or both ears to try to find the most useful response to treatment.
Thank you.
Excellent. Thank you. Go ahead, Brandy.
Thanks, Melissa. Yes. Thank you, Dr. Stanton. Is auricular acupuncture typically covered by insurance when it's part of a treatment plan from a medical doctor?
It depends on the insurance. It depends on the insurance. Medicare, for example, didn't cover acupuncture at all until I think about 2 or 3 years ago, but it only covers acupuncture when it is given for chronic back pain. So if somebody, for example, has chronic back pain as a problem, but also happens to have any other type of pain, including trigeminal neuralgia, if the back pain is included in the treatment paradigm, which it may be, then as long as it's an appropriate diagnosis with an appropriate treatment, then Medicare should cover it. Many other insurers will have more or less coverage. Commercial insurances tend to have better coverage, but the best thing to do is to just call your insurance company and find what is or isn't covered. I'm hoping that with time, all insurances will cover acupuncture. One of the best insurance coverages for acupuncture is Federal Blue Cross Blue Shield, which means that all of our congressmen can get acupuncture.
Wow, that's incredible. Thank you for sharing that and for sharing that piece of information there. Another question is, can most acupuncturists perform auricular acupuncture?
I think that, well, I'm not positive, but what I can tell you, and I alluded to this a moment ago, that certainly nowadays, ear acupuncture is included in the education of all non-physician acupuncturists, and certainly any physician who's trained in acupuncture. There are certain medical schools and also non-medical school programs that train physicians in what we call medical acupuncture. All the medical education programs for physicians and all modern non-medical acupuncture schools teach ear acupuncture. If somebody is let's say, has graduated at a time a long time ago when the ear training was not provided to non-physician acupuncturists, then certainly many acupuncturists are aware of, especially the battlefield acupuncture protocol that is so pervasive now. It is so widespread that even if someone hasn't had the type of training, for example, that I had, I went through a whole training program in this, but even if a person hasn't had that, still a person can learn battlefield acupuncture fairly fast, and that's why the Pentagon adapted it. You can learn it even in a weekend course, because it's a fairly straightforward protocol. It's like when in China during the communist revolution, the barefoot doctors were educated in acupuncture, including ear acupuncture, simple protocols, and they'd be sent out into the countryside and treat people with these protocols that they had learned probably in fairly fast, very dedicated training programs. So I think that you have many healthcare practitioners now who are aware at least of battlefield acupuncture, probably the NADA protocol, and if they've had a more formal education in these other types of approaches that I'm mentioning.
Excellent. Thank you so much. And just here as a last question, we have a couple of minutes and then we have our final session. Is there anywhere that people can go learn more about this, a current research or places where people can do their own individual research? Where would you recommend people interested in this treatment go? Certainly,
again, the AAMA, American Academy of Medical Acupuncture website is a very good initial point for researching medical acupuncture, including auricular acupuncture. If you Google auricular therapy, if you Google auricular acupuncture, you're going to come up with all sorts of websites. You might even see an article or two that I wrote online, and many other authors. So I think it should be very, very easy to access some information. But the AAMA website is a wonderful way to start. And there are also websites that are websites of licensed acupuncturists, non-physician websites and organizations that also are very informative and helpful to patients. So I think the availability of information about ear acupuncture is really literally at our fingertips if only we have a computer.
Excellent. Thank you so much, Dr. Stanton, for your fantastic presentation this evening. This is our last full session of the day, but I hope you will join us for our wrap-up. Amson Necki is going to talk about the FPA's patient registry, and we'll spend a few minutes looking ahead at where the FPA is going. If you aren't able to join us, I would like to ask that you please complete the brief post-event survey that will be emailed to you at the end of the conference. By doing so, you are helping us to make these programs even better. You will also be entered to win an Amazon gift card or a copy of our book, Facial Pain, a 21st Century Guide. Thank you so much for joining us for this year's conference. Please navigate to your agenda and join the conclusion session. Thanks so much. Thank you, Dr. Stanton.
My pleasure. Thank you for attending.
Absolutely.